Hi, my name is Dr. Matthew Connor, and I am a surgeon at Tallahassee Ear, Nose, and Throat. Today, we are talking about ear tubes. The medical term for ear tubes is myringotomy with tympanostomy tube placement. What that means is we make a small hole in the eardrum and place a very small tube. We will discuss the reasons why tubes are sometimes needed, how the procedure is done, and how to care for the ears after the surgery. At this point in time, you or your child probably have had many ear infections or fluid in the middle ear which will not resolve. You may have also noticed that you or your child turns the TV up very loudly and cannot seem to hear when being spoken to. For children, this is the time in their life when being able to hear is very important. Speech and language skills are developed during these early years, and a hearing loss can impair the development of these skills. Many people ask, why do children get so many infections? Probably the primary reason is poor eustachian tube function. The eustachian tube is a small tube that runs between the nose and the middle ear. Its purpose is to ventilate the middle ear and to equalize the pressure between the outside environment and the middle ear. Normally, adults equalize the pressure in their ears by swallowing. The eustachian tube opens when we swallow. Your child's eustachian tube does not operate as efficiently because it is shorter, more horizontal, and less rigid. As your children grow, their facial structures grow and change, and their eustachian tube begins to function much more like an adult's tube. Another reason for eustachian tube dysfunction is enlarged or infected adenoids. Children tend to have large adenoids, and because they are in close proximity to the eustachian tube, they may interfere with the eustachian tube function or serve as a reservoir for infection. A middle ear that is not well ventilated, either due to eustachian tube dysfunction or enlarged infected adenoids, will result in fluid in the middle ear. The moist and warm environment invites bacteria, and infection often follows. We also know from research studies that children in daycare or those exposed to smoking in the house are at an increased risk for ear infections and eustachian tube dysfunction. Patients often ask, why is there a hearing loss? In most cases, antibiotics do take care of the infection in the middle ear, but the fluid in the middle ear space may not resolve, even after excellent treatment. The fluid behind the eardrum does not allow the eardrum to move very well, so there is a decreased conduction of sound waves to the inner ear and brain. So, how will ear ventilation tubes help? They function, as their name implies, to ventilate the middle ear. These are very small tubes, and they are microscopically placed in the eardrum. They will serve as a substitute eustachian tube in that they will equalize pressure in the ear and keep it well ventilated. Also, fluid will not collect in the middle ear space with the tube present. When there is no fluid in the middle ear, your child will hear better and be less prone to infections. However, some infections may still occur, but they will be easier to treat with antibiotic drops through the ear canal, and oral antibiotics are usually not necessary. The tube usually remains in place for 6 to 18 months and is gradually pushed out of the eardrum. The eardrum heals as the tube is pushed out. There are many advantages to having ear tube placement, including decreased incidence of infections, improved hearing, prevention of long-term damage from middle ear fluid and negative pressure. Alternatively, the following are the disadvantages to having ear tube placement. There is a 20% chance of some type of problem, mostly minor ones, including 10% of patients will deal with continued infections. 3% of patients may have plugging of the ear tubes. 2% may have early extrusion of the tubes. 3% may have a persistent hole in the eardrum that remains after the tube comes out. And there is about a 20% incidence of repeat tube insertion after the tube comes out, because some children may need more time with tubes before their eustachian tubes will fully develop. So, now that you know a lot about ear tubes, who needs them? Because most children will clear middle ear fluid on their own, ear tubes are usually offered if children have hearing loss and fluid present for longer than 3 months. If children have fluid for longer than 3 months but do not have a hearing loss, then they have ear tubes if they experience symptoms related to the fluid, if they have recurrent ear infections, or if they are at risk of speech, language, or learning problems. The surgery is fairly simple. If your child is only to have ventilation tubes inserted, a mask and gas anesthesia are all that are used. There is no IV or breathing tube. For most adults, we may perform the surgery in the office without any general anesthesia. The procedure takes only a few minutes. Your child should stay home from school the day of surgery, but may resume usual activities. Some children may return to school the following day. However, some children may need an extra day to recover. Mild discomfort for the first day is normal. There usually isn't too much after that. Take over-the-counter acetaminophen or ibuprofen as directed every 6 hours to control any pain after surgery. You will sometimes be given an antibiotic ear drop. Be sure to use good technique when applying the drops. Hold the ear out, place the drops into the ear canal, and pump the tragus. This is followed by holding the head off to the side for 5 minutes. A piece of cotton in the ear keeps the liquid from running out. The leftover drops can be used in the future. There may be some drainage of fluid or slight bleeding noted after the surgery. This is normal. You can remove and replace the cotton ball in the ear as necessary. Because the tubes are so small, most children do not need to wear earplugs with water exposure. However, earplugs are recommended if swimming more than 6 feet underwater, swimming in lakes, or non-chlorinated pools. There are many soft-fitted earplugs available, as are special neoprene headbands to cover the ears. Our audiologist can also make a custom earplug for you. We hope that this video has helped you to understand the risks and the benefits of ear tubes and what to expect during your recovery. If you have any further questions or concerns, please contact our office at any time.